Hello everyone and welcome to Module 10 of the PSW NACC exam. This module will cover questions on assisting with medication. So we are starting right off with question 1. When administering eye drops, it is best to position the client A. Forward, B. Slightly to the left, C. Slightly back, D. To the right. When administering eye drops, the client should be positioned slightly back with their head tilted upward. This positioning will allow the eye drops to be applied accurately to the lower conjunctival sac without spillage or discomfort. Generally, the steps to take is to first of all wash hands thoroughly to maintain hygiene, then position the client comfortably with their head slightly tilted back. Gently pull down the lower eyelid to expose the conjunctival sac, and then administer the prescribed number of drops into the sac without touching the eye or eyelid with a dropper. Then you instruct the clients to close their eyes gently and avoid blinking excessively to ensure proper absorption. The other positions would make it harder to administer the drops effectively, and it will also increase the risk of the medication not reaching the intended area. So our answer is option C. The client should be positioned slightly back. Question 2. Weakness on one side of the body and difficulty speaking are signs of A. Cardiac arrest, B. Diabetes mellitus, C. Cerebral vascular accident, D. Myocardial infarction. Cardiac arrest involves the sudden loss of heart function, but it is not associated with localized weakness or speech difficulty. Diabetes mellitus can cause complications such as neuropathy, but it does not present with one-sided weakness or speech issues. Weakness on one side of the body and difficulty speaking are classic signs of a cerebral vascular accident, commonly known as a stroke. A stroke occurs when blood flow to a part of the brain is disrupted, either due to a clot or a bleed, and this can result in damage to brain tissue. These symptoms will indicate that the area of the brain responsible for motor function and speech may be affected. Myocardial infarction refers to a heart attack, and this is characterized by chest pain, shortness of breath, and other symptoms related to heart function, rather than neurological deficits. So with respect to the question, our answer is option C, cerebral vascular accident. This is also known as a stroke. Question 3. Which of the following is used to relax sore muscles, relieve joint pain, and increase blood circulation? A. Cold application, B. Heat application, C. Bed rest, D. Suppository. Cold application is used to reduce swelling, inflammation, and numb pain, and it is usually used for acute injuries. Heat application is used to relax sore muscles, relieve joint pain, and increase blood circulation. Heat works by dilating blood vessels, which improves blood flow to the affected area. It also reduces stiffness and promotes healing. Examples of some ways to apply heat application is through the use of heating pads, warm compresses, or warm baths. Suppositories are a method for delivering medication, and it's often used for conditions like constipation or fever, but they don't provide muscular or circulatory benefits. So with respect to the question, our answer is option B, heat application. It is used to relax sore muscles, relieve joint pain, and increase blood circulation. Question 4. Where would you safely store a bottle of aspirin in a client's home? A. Sealed plastic bag, B. A locked cabinet or high cupboard, C. Refrigerator, D. Dresser drawer. While sealing protects from moisture, it does not ensure safety from accidental ingestion if the bag is accessible. Medications such as aspirin should be stored in a secure location that is dry, cool, and out of reach of children or vulnerable individuals. A locked cabinet or high cupboard is ideal to ensure safety and prevent accidental ingestion. Aspirins do not require refrigeration, and storing it in a fridge can expose it to moisture, which may degrade the medication. Dresser drawers are accessible to children and others, and this makes it an unsafe option for medication storage. So the best place to store a bottle of aspirin in a client's home would be in a locked cabinet or a high cupboard. Question 5. What abbreviation is used when a medication is to be taken at bedtime? A. QID, B. HS, C. BT, D. PC. QID stands for quarter in die, meaning 4 times a day. HS is an abbreviation for horror somni, and this is Latin for at bedtime. So it is commonly used in medical prescriptions that indicates that the medication should be taken just before going to sleep. BT is not a standard medical abbreviation, and PC stands for post-sebum, which means after meals. So the abbreviation for when a medication is to be taken at bedtime is option B, HS. Question 6. An inflammation of the clear membrane that covers the white part of the eye and lines of the inner surface of the eyelids and is commonly referred to as pink eye is called what? A. Conjunctivitis, B. Reye's syndrome, C. Otitis media, D. Gastroenteritis. Conjunctivitis, which is also commonly referred to as pink eye, is an inflammation or infection of the conjunctiva, which is the clear membrane that covers the white part of the eye and the inner surface of the eyelids. It is characterized by redness, swelling, itching, and discharge from the eye. The causes could be due to bacterial or viral infections, allergies, or irritants like smoke or dust. Reye's syndrome is a rare but serious condition that causes swelling in the brain and liver, and it is linked to aspirin use in children recovering from viral infections. Otitis media is an infection or inflammation of the middle ear, but not the eye. Gastroenteritis is an inflammation of the stomach and intestines, and it is usually caused by an infection leading to diarrhea, vomiting, and abdominal pain. But with respect to the question, our answer is option A, conjunctivitis. Question 7. Which of the following identifies the 5 rights in administering medications? A. Right person, time, dose, amount, temperature. B. Right dose, label, client, day, medication. C. Right person, color, amount, day, route. D. Right dose, client, medication, time, route. The 5 rights of medication administration are a standard safety guideline to ensure that medications are given accurately and responsibly. This includes, first of all, the right clients, so you have to verify the identity of the client. Secondly, right medication. You ensure that the medication matches the prescription. Thirdly, right dose. You have to confirm the correct amount to administer. Fourthly, right time. The medication has to be administered at the prescribed time. And number 5, right route, using the appropriate method of delivery, either oral, topical, or by injection. So our answer here is option D. Right dose, client, medication, time, and route. Question 8. Which of the following is true about medication safety for PSWs? A. PSWs can store medications wherever is convenient for the client. B. PSWs should always double-check medication expiry dates. C. PSWs can mix medications into food without informing the client. D. PSWs are responsible for prescribing new medications. In option A, medications should be stored according to the care plan and safety guidelines, such as in a locked cabinet or a designated safe location. Convenience should never override safety. In option B, checking the expiry dates of medication ensures that they are safe and effective for the clients. So PSWs play an important role in assisting with medication safety by being vigilant about expiration, and this is a key responsibility for the PSW. For option C, mixing medications into food without consent or direction from a healthcare professional is not allowed, and it could violate the client's autonomy or affect the medication's efficacy. PSWs are also not authorized to prescribe medications. Only authorized and qualified healthcare professionals like doctors or nurse practitioners can do this. So our answer here is option B. For medication safety, PSW should always double-check medication expiry dates. Question 9. What is the role of a PSW when assisting with medications? A. Administer medications directly. B. Provide the clients with their prescribed medication and ensure they take it. C. Remind the clients to take their medications as directed and observe them. D. Change the client's medication dose if they feel it is too high or too low. PSWs are not authorized to administer medications, including injections or controlled substances. While PSWs can assist in providing medications, they are not responsible for ensuring that the client takes it or for monitoring the dosage. The role of a PSW in assisting with medication includes reminding the clients to take their prescribed medications and observing the clients for any adverse reaction or issues. PSWs do not administer medications directly, change the dosages, or alter the prescribed treatment plan. They only act as a support in following the healthcare provider's instruction. For option D, only licensed healthcare professionals like doctors or pharmacists are authorized to adjust medication dosages. So, the role of a PSW based on the options we're presented with is option C, to remind the client to take their medication as directed and observe them. Question 10. What should a PSW do if they notice a medication error? A. Ignore it if the client does not show any symptoms. B. Correct the error and proceed without reporting. C. Report it immediately to a supervisor or nurse. D. Dispose of the medication to avoid any issues. Ignoring a medication error, even if the client seems fine, is very dangerous because the effects of the error may not be immediately apparent. Secondly, PSWs are not authorized to make corrections on their own without informing a nurse or a supervisor, so reporting is essential for appropriate follow-up. If a PSW notices a medication error, they must report it immediately to a supervisor or a nurse. Reporting the error ensures that the appropriate action is taken to correct the mistake and to prevent any harm to the client. Ignoring the error or trying to resolve it without reporting it could lead to further complications and potential risks to the client's health. In option D, disposing of medication without guidance can lead to improper handling and potentially violate policies. So the correct line of action would be option C. Report it immediately to a supervisor or a nurse. Question 11. Medication to be taken after a meal will use what abbreviation? A. AC. B. PC. C. P-O-D-O-B. Option A stands for ante-sebum, which means before meals. Option B stands for post-sebum, which is Latin for after meals. Option C stands for per OS, meaning by mouth, while option D is not a standard medical abbreviation for medication administration. So with respect to the options we have, our answer is option B, post-sebum. It is used to indicate that a medication should be taken after the client has eaten. Question 12. What chemicals does a drug allergy release in the body? A. Antivirals. B. Antibodies. C. Antiemetics. D. Antigens. Antivirals are medications used to treat viral infections, but they are not chemicals released during an allergic reaction. When the body experiences a drug allergy, the immune system mistakenly identifies a harmless substance, which is the drug, as a harmful evader. So in response, the body produces antibodies, which triggers allergic reactions like swelling, hives, difficulty in breathing, or anaphylaxis. Antiemetics are drugs used to prevent or treat nausea and vomiting, while antigens are substances that provoke an immune response. But in an allergy, the body produces antibodies in reaction to the perceived invader, which in this case is the drug. So with respect to our options, we'll be going with option B, antibodies. Question 13. While working in a long-term care residence, you notice that your elderly client does not always swallow his pills and will spit them out after the nurse has left. What should you do? A. Tell the nurse who is administering the medication. B. Give him applesauce and insist he swallow them. C. Not interfere, as it is not your responsibility. D. Report that he has not swallowed the medication on his chart. If you notice that a client is not swallowing their medication, it is your responsibility as a PSW to inform the nurse or healthcare professional who is administering the medication. The nurse can then assess the situation, determine if the medication needs to be given in a different form, or make other adjustments to ensure the client receives the necessary treatment. In option B, while some medications can be mixed with food, insisting that a client swallow medication without following proper protocol or consulting the nurse could lead to complications. For option C, as a PSW, you are responsible for observing the client's well-being and ensuring proper care, and this includes reporting any issues with medication adherence. In option D, while documentation is important, informing the nurse immediately is essential for proper follow-up, and it ensures that the client receives the medication as prescribed. So we'll begin with option A. The best thing to do is to tell the nurse who is administering the medication. Question 14. Which of the following is an important guideline when assisting with medications? A. Guess the medication dosage if the instructions are unclear. B. Read the medication label carefully before assisting. C. Crush all medications to make them easier to swallow. D. Store medications in any accessible place. In option A, you should never guess the dosage. If the instructions are unclear, you should ask a nurse or pharmacist for clarification. Reading the medication label carefully is crucial to ensure that the correct medication is given to the right client and in the proper dosage and also at the right time. The label provides vital information such as dosage, administration instructions, expiration date, and potential side effects. For option C, not all medications can be crushed, as it can alter their effectiveness or even cause adverse reactions. So always check with a healthcare provider or professional before altering how medications are taken. In option D, medication should always be stored in a safe, secure location as per safety guidelines in order to prevent accidental ingestion or misuse. So our answer here is option B. Read the medication label carefully before assisting. Question 15. Medications suspended in a liquid that should be shaken or stirred before use are called A. Capsules, B. Elixirs, C. Tablets, D. Suspensions. Capsules are solid dosage forms that contains medication in a gel-like shell, and they do not need to be shaken. Elixirs are sweetened liquid medications that typically dissolve in alcohol or water, and they don't require shaking in the same way that suspensions do. Tablets are solid medications that are taken orally, and they do not require shaking or stirring before use. While suspensions are liquid medications that contain solid particles suspended in a liquid. These particles do not dissolve completely, and they can settle at the bottom of the container. So there is always a need to ensure that it is shaken or stirred before use to ensure proper dosage is administered. So our answer here is option D, suspensions. Question 16. What does proprietary name mean? A. Official name of the drug. B. Another name of the PSW. C. Trade name of a drug. D. Name that the client is assigned. The official name of a drug is often called the generic name. In option B, this is unrelated to medications. The proprietary name refers to the drug and not the PSW. The proprietary name of a drug is its trade name, which is the name given by the manufacturer or brand that markets the drug. It is often a trademark name and is typically the name under which the drug is sold to the public. In option D, this is unrelated to drugs. A client's name is personal and it is not associated with the proprietary name of a medication. So our answer here is option C. The proprietary name of a drug is its trade name, and it is a trademark name under which the drug is sold to the public. Question 17. Which of the following is not a responsibility of a PSW when assisting with medications? A. Observing for side effects or adverse reactions. B. Reporting any medication errors immediately. C. Ensuring the client takes medication according to the prescribed schedule. D. Deciding which medication to give if multiple prescriptions are present. Option A is an important part of medication safety and also a responsibility of the PSW. The same goes with option B. PSWs must report medication errors to ensure the client's safety. In option C, PSWs must also remind clients to take medications at the right time under the correct condition. So the option that is not a responsibility of a PSW is option D, deciding which medication to give if multiple prescriptions are present. A PSW does not have the authority to decide which medication to give when there are multiple prescriptions. This decision is the responsibility of a licensed healthcare professional like a nurse or a doctor. The PSW should only follow the prescribed instructions and report any concerns or issues to the appropriate healthcare provider. Question 18. What should a PSW do if they notice a client experiencing side effects after taking medication? A. Ignore it and wait for the side effects to subside. B. Call emergency services immediately without assessing the situation. C. Report the side effects to the supervisor or nurse promptly. D. Stop assisting with all future medications. For this, we'll begin with option C. If a PSW notices that a client is experiencing side effects after taking medications, they should promptly report the side effects to the supervisor or nurse. The healthcare professional can then assess the situation, determine the severity of the side effects, and provide appropriate guidance or intervention. Question 19. Which of the following is a key sign of a medication overdose? A. Drowsiness and fatigue. B. Excessive thirst and urination. C. Nausea, vomiting, and confusion. D. Mild headache and dizziness. While option A can be a side effect of some medication, it is not a specific indication of an overdose. Option B, excessive thirst and urination are symptoms that can occur with certain conditions like diabetes, but it is not a sign of a medication overdose. Overdose symptoms often include nausea, vomiting, confusion, and other more severe reactions depending on the medication involved. So if any of these symptoms are observed, it is essential to seek medical attention immediately. Mild headaches and dizziness can occur with many medications, but again, they are not specific to an overdose and they are more common as side effects. So with respect to the options, option C, nausea, vomiting, and confusion are key signs of a medication overdose. An overdose can overwhelm the body's ability to process and eliminate the drug, leading to these symptoms and other serious symptoms. So it is crucial to seek medical attention immediately if any of these signs appear. Question 20. What should a PSW do if they accidentally administer the wrong medication to a client? A. Ignore the error and continue assisting the client. B. Report the error to the supervisor or nurse immediately. C. Wait until the client shows symptoms before reporting. D. Try to correct the error by giving the correct medication right away. Option A, ignoring the error can lead to potential harm to the client, so it is critical to address the situation promptly. What the PSW should do is to report the error immediately to the supervisor or nurse, who will then assess the situation and take appropriate action. This may include monitoring the client for adverse reaction or taking steps to correct the mistake. Option C, reporting the error immediately is important, regardless of whether the symptoms appear right away or not. In option D, giving additional medication without guidance can cause further harm, so the supervisor or nurse should be the one to direct the next steps. So our answer here is option B. Report the error to the supervisor or nurse immediately. They will now be in the position to assess the situation and take appropriate action. This brings us to the end of the Module 10 video on the PSW NACC exam. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when Module 11 drops. Thank you for watching, and I'll see you in the next video.